normally expect questions to be asked so that we can help the young homeopaths to find out how to enter the case and how to find out the rubrics. If not there, then basically I take the symptoms of the remedy and then try to get to the remedy. Of late, I had few questions on the WhatsApp. So if there are no questions, I would take something on the WhatsApp and then again go to the question answer session. Remedy wise speaking, if you understand the remedy through mind, now it is not necessary. I always tell you that understand the first mind only. If you can't get the mind also, you can enter the case from other things also, like the symptom related to stomach or the generalities or extremities or head, chest, anywhere, because everything in the body, everything is related to DNA, and every constitution will take out symptoms or give symptoms in relation to the affection. So the whole body will speak. So when the whole body starts speaking, it will speak from different spheres and from every sphere. So it is important for you to understand that it is not only the mind which is important, it is basically the whole constitution is important. Some enter the case through mind, some enter the case through generalities, some enter the case through different patterns of entering, different ways of understanding the remedy. So I just discussed the case last time, and again I had a query, that sir, again discuss that case. That case was of Robinia. Now this was a very interesting case. A girl had come to me. I think she was, sir, what is your good afternoon, Vishaka? What is your upon Bachelor remedies can cure conditions? No, I have very sparingly used Bachelor remedies, and I cannot comment on that because I have been practicing very little about Bachelor. So for me to comment on Bachelor would be very difficult for me, because clinically I always say that theoretically I can tell you all the symptoms of most of the Bachelor remedies, but clinically if I have not found useful in my practice, because I am not practicing, then I cannot comment on it. So symptomatic, if you want, I can tell you some symptoms of remedies, but I would not tell you that because I have not been practicing Bachelor. So let us go forward. So I was telling you something in relation to, so how to reduce lipoprotein A when lipid levels everything decreases, but lipoprotein doesn't decrease. Now remember one thing: if you're treating a case of a lipoprotein, or if you're treating a case of cholesterol and nothing is working as such, that means your remedy is very close but not the minimum. Remember this pattern. If you're treating a case of hypercholesteremia and you find that all the levels have been decreased, but one level is not decreasing. Of course, try to find out the pathology behind that. But whatever I have seen in my practice, it is basically your remedy is very close to the minimum, but not the minimum. Just go and see the follows well. Just see it complementary remedy, and then you can get to the remedy and correct the case. This is my opinion. Okay. And treating cholesterol or lipoprotein or diabetes and all requires a very deep understanding of the remedy also, the symptom also, and the repetition of potencies. Whatever I have seen in my practice, repetition, homeopathy would be basically in future would be the potency and the repetition. How much to repeat, when to repeat, because I have seen in lot of students who are working with me, they every time don't get the remedy first, they get the partial simillimum. So sometimes repetition and sometimes what to repeat, when to be on dose depends on case to case, how much in depth you have got in case taking. Okay, some medicines which help both in very severe neuropathy together. No, I have told you this question has been answered before also. Don't ask me the specific remedies for neuropathy and myopathy. I am not that type of practitioner. I cannot answer that specific questions. So don't ask me those type of questions, and try to ask me questions on this YouTube only, because in WhatsApp it becomes difficult for me to answer both on WhatsApp and YouTube, and sometimes on Skype also. So let us go forward. Don't ask me some direct questions because I don't know about myopathy and neuro. I have answered this question before also. So I was just telling you something about Thuja. I think last time we had completed Thuja, And one symptom which my doctors who are working with me, they told, so I forgot to tell you that symptom. Thuja has one more symptom in relation to mind, which you should think about. A Thuja patient normally has a lot of confusion, and there is a very interesting symptom, or you can say interesting rubric for Thuja, that a Thuja patient cannot tell what is wrong and what is right. It is not confusion, but it's a very beautiful symptom of Thuja. Wrong tell what is cannot. मतलब इसका you can think that he does not know what is right and what is wrong, or he is not able to judge what is right and what is wrong, and that's why this also becomes a very interesting symptom of Thuja, because Thuja has fixed delusions, that the body is made of wood and brittleness and everything is very fixed. So this symptom you please add in your mathematica, that he cannot tell you what is right and what is wrong. That's a symptom of Thuja. Oral cancer after operation and radiation. So what do you tell me? What do you want me to tell? Remedies for oral cancer after operation, what to do, what to give so it does not come back, or remedies for oral cancer? You can ask a proper question so that I can answer you this question also. Because if the patient has already been operated for an oral cancer, then the problem starts where the patient basically wants a remedy that the cancer should not come again. And if the patient is suffering from oral cancer, that means you have to prescribe basically on how is the ulceration, how is the cancer, does not come back again. Okay, nice. So 2 or 3 things you have to remember in treating cancer. Maybe it's an oral cancer or any type of cancer. First of all, it is basically a syphilitic problem, so remedy has to be an anti-syphilitic remedy. Second, if it is a syphilitic case, then you must find out whether it is oral cancer is basically because of occupational or because of a syphilitic trend. Meaning, if the patient is a habit of eating a lot of tobacco, chewing betel leaf, doing cigarette and all, and day in and day out he is in a habit of doing that, then basically you have to take occupational also. But because all patients going for smoking or tobacco chewing or betel leaf chewing don't have cancer, so that's why constitution is important. For me, if you ask, first the thought comes, first the cancerous state comes, then you can see the cancer in the patients physically. So in case taking, you have to understand what is the syphilitic thought. For example, if the patient of cancer comes to you and says, Doctor, I have no lot of problem now, what will happen, a lot of anxiety, that symptom is there, but it's a psoric symptom, If you prescribe on psoric symptom in case of cancer case, you will not be able to cure a case of cancer. Okay, so you have to find out what is the syphilitic trend, what is the syphilitic thought that the patient is going through, and then you can take that symptom for prescription, because that thought process has taken out from the somatic symptom from the body to the weakest part, and that part, oral part, is weak because it has been made weak physically also by chewing a lot of betel leaves or cigarette smoking or XYZ. So this should be your entry point of the case. Just 2 or 3 things in oral cancer. There are beautiful remedies for oral cancer which I have been using and treated a lot of cases of oral cancer in my practice, preventive also and curative also. There are some remedies which are very, very important. First remedy you must think about in oral cancer is phosphorus. Second, lachesis. Third, kali cyanide. Fourth, causticum. And fifth is calcarea car. Of course, there are so many remedies then. 2 days before only I got a case of a cancer of tongue. I've just started the treatment. Let me see how does the patient react, and we'll give the medicines. Okay. Hello, Dr. Babal. Welcome. Sir, taking calcarea 3x for pain, can I increase to the... See, you are taking calcarea because you thought that the patient has calcarea. So if it is right, then you decide the potency what to give. I have never given calcarea 3x in my practice. So what should be the remedy for constant sneezing and nasal discharge? Very, very easy, very, very easy in case of this. Which remedy should give, give the patient a placebo and tell the patient to take the placebo in hot water or warm water 3 times a day or 4 times a day. automatically the sneezing will be better. Normally, of late, for years I have not been prescribing this symptom, but there are few remedies basically very very common for sneezing. You can write down the remedies, very very common. You can think of sabadella, arsenic, ammonium carb, senna, bryonia, orendo, histamine. These are the remedies you can think for sneezing. But for me, just give the patient placebo and take the patient to take in hot water. The sneezing would be better. If it does not get better, then maybe you can think of some remedies which I have told you. You can include sanguinaria, pulsatilla, teucrium, lot of remedies for sneezing and all. If the patient comes to you for allergic rhinitis and for sneezing, placebo in hot water for 15 days, wait and see how the patient reacts, then give the medicine. Don't waste your medicine. If the patient has been taking chronic treatment for you and in between he gets cough, cold and sneezing, wait, again placebo in hot water, because it may be the elimination of what medicines you have given. Okay. In lower lip, black spot are there, which is dry and slight itching. Medicines. See, whenever you are treating a symptom, if you are treating a symptom, what happens? If you treat that, for example, in your case, if there is, lower lip has a wound. Now, whenever a lip has a wound and eruptions, you think of three remedies which are very, very common that you should think about: natramur, phosphorus, sepia, silicia. Now, then you can differentiate why the spot has come, how the spot has come, how is the lip, and one more remedy which I have used in my practice very sporadically but with good result is benzoic acid. Of course, I had a case of gout which was classical benzoic acid. He had problem of recurrent cough and cold, and cough discharge would be greenish in color and blackness or spots on lip. So I prescribe on these symptom benzoic acid. The gout is better, the cough is better, and the lip black spot is also gone. So it depends on case to case. Okay. I am your patient for last 3 months. My 6 months CT is nil of oral cancer. Thanks, sir. Oh, thank you so much, and thank you so much for at least speaking in front of the audience, so that the confidence of treating cancer, the confidence of that homeopathy works is important for my audience. Because I telling you that I have cured case of cancer, and the patient giving the testimonial, it brings a lot of confidence in my audience and the doctor also. That's why I keep putting my cured cases of late. This is all because of my doctors who are working with me. They have told me, sir, put some cases, so I keep putting some cases. These are testimonials which I have seen in my practice. I think put testimonial of I think a case of vertigo, case of cancer, case of the patient was on pacemaker, and so pacemaker was advised to the patient, and now the no pacemaker is required because homeopathy is going on, treatment is going on. A case of asthma also. These type of cases I keep putting in my. Thank you so much. Hypericum for neuralgia. You can give hypericum is the remedy. Don't ask me remedy, and don't ask me disease, because if you have seen my post today, I think there was a case of a girl who had done something wrong on social media, and she was fearing that maybe the father will know or my friends will know, and what will happen. So I took only one rubric, fear of disgrace. I gave the patient Rubainia, that treated and cured the case. Because of that disgrace feeling, she was suffering from loss of appetite, loss of sleep, could not memorize, lot of memory, could not study, and all symptoms of depression. With a single dose of Rubainia, within 3 days the patient is up on the feet. So fear of disgrace. Now Rubainia can never be thought for mind problems for this, but because our interpretation is all about homeopathy, that's why Rubainia cured the case. So don't ask me that hypericum is good for neuralgia. It is good. It is written in the book, so I cannot say it is not good. But dose that depends upon the susceptibility of the patient. Normally, if I want to prescribe hypericum, I would basically rather try for an LM potency rather than potency now. Okay. So let us go forward. So you understood something, I just a passing thought on lips. I had a case, a lady was there, she was about 33, 34 years of age, I don't know what the disease she was suffering, but I, remember that the lady came to me, and during case taking, she used to do like this, like this, always doing like this, and it was looking quite odd doing a case taking in front of me, and you know, doing lips like this. And she also told me, sir, don't mind it because I have a habit of doing this. Can anyone tell me? Can anyone tell me what is this symptom and which remedy I prescribed? I took the whole case, but I prescribed on that symptom only, and the patient was better. Can anyone tell me what is the meaning of this? She was doing like this in front of me. So we'll not waste time. I'll just give about 30 seconds if you can answer. Yes, anyone? What is this? What is this? What is the patient doing in front of me? And then I prescribe the remedy. So this was a symptom taken by me, that habit of wetting the lips. Habit of wetting the lips constantly, and the remedy is Culex. Now, if you read Culex, it's basically mosquito. You can never have this symptom in Culex, but I did not prescribe on the disease state, like for hyperemia for nerve and all. So I prescribed on the symptom state. And any remedy, if you see in your Mater Medica, automatically it becomes a remedy for the person. So I prescribed the patient Culex, wetting the lips. I remember one more case. One of the doctors was sitting with me, and the case was of asthma of a child, and the child used to talk so much, like lachesis, but not lachesis. Otherwise, loquacity, one remedy, lachesis, every time. I think if she's online, she can tell you the remedy also, and the symptom I took for prescription. She just came yesterday and she was much better. In fact, the talking part also was much better in that case. My father is suffering from swallowing food, did endoscopy, all reports are normal, but still facing problem of swallowing as well as water. Yeah, this is a very, very common problem in old age. This is called as mobility problem. This is called as the muscles are not functioning according to the will. I had a wonderful case where the patient had a problem of drinking water, not with food. So whenever the patient, when he used to wanted to drink something, he used to take a morsel of food with him, drink, and take the morsel of food, and used to go inside. It was a problem of mobility. The mobility of muscles was lost, and the problem was with swallowing. So the muscles were not obeying the will of the esophagus upper part, or you can say the lower part of the throat. And that was the case. Of course, that case, the patient came to me, his weight was about 75, and because of this problem, his weight came to be 35. And the doctor had advised him to take Botox or a surgery, which was very risky. And the patient is still with me, although the patient is not better, but you can say about 5% better. So this is a problem of mobility of the muscles. In spite all reports, even the endoscopy, the CT, the MRI, all the reports, the bronchoscopy, all the reports are normal. Okay, just a correction, the remedy is Culex, Culex. So the doctors who are writing have made a spelling mistake. It is Culex musca, Culex musca. Okay. So I think this is taken care of. Do you understand the problem, my dear friends? So let us go forward. Few questions are scrolled up. It is Culex. So just now you can have a lot of other symptoms in connection with the lips problem, wetting the lips, ulcers on the lips, eruptions on the lips, dryness in the lips, biting the lips. Especially I had a case, biting the lips on eating, and again the remedy in that case was benzoic acid. You understand the remedy. Now benzoic acid can never be thought because for biting the lips, especially while eating. Sometimes we have biting the cheek while eating. The drugs change. This is homeopathy. So my suggestion would be basically Don't be, specific case for this disease, this remedy, for this disease, this remedy. Take the symptom, observe how is the patient telling you, and then you can always think about the remedy. Okay. A girl 16 years, fear in the classroom that the other students talk about her and make fun about her. This is not real, but she thinks about. Okay. Now this is now whenever you have these type of symptoms and people watching you, and so there are few rubrics we should take care of. Delusion, criticize she, delusion, others will observe the reason. These are the two things you have to take for prescription, and then you can get the remedies. But my suggestion would be, don't prescribe on this symptom, because a grand generalization for this symptom would be lack of confidence. So if you prescribe on this symptom, I don't know whether it would it will work or not. For example, we have a rubric called delusion, that others will observe the confusion. The remedies, calcare carb, I think. So delusion, that what do you call? People will observe her. So delusion that she is hated by others. It's a delusion. Now there are a lot of other type of delusions. So if this is basically lack of confidence, if it is very very marked, you can take that symptom. But do take other symptoms also for prescription. Only you prescribe for one rubric, you might sometimes not get the remedy. There are fear that others are approaching. This is also rubric. So these rubrics, 1 mark rubric and 1 mark remedy. If you take it, if you get it, well and nice. If you don't get it, then there's a problem. So always take at least 3-4 symptoms for prescription. Yeah, garrulous loquacity. Yeah, Dr. Divya was then the patient came yesterday only, and surprisingly, of course, asthma was better, and she was talking less also. She was appearing nice yesterday. So let us go for a 6. I hope you understood something about that. Lack of confidence, that's more important rather than taking that symptom for prescription. So let us go forward. Do write the meaning of what is the meaning of garrulous, because garrulous loquacity and loquacity of lachesis differs. Otherwise, loquacity and the patient keeps talking. We prescribe lachesis, of course. It's the hallmark symptom of lachesis, but not only lachesis, there are other remedies also. So I hope this question is answered, doctor, and let us go forward. If not, you can ask me. I can have a lot of other rubrics also for a simple, people will observe the reason and delusion, but these are quite common symptoms of remedies. So let us go forward. I think this is taken care of. Now if you again go to the remedy, where I think we were, lips part is taken care of, and that basically is everything in lips which I could gather. Now again, coming back to thuja, if basically if you are not done thuja, apart from mind, you can have other symptoms of thuja also, which are very very important. For example, if you take the Boningosian's grand generalization, that also is thuja. So Divya, if you can write what is the meaning of garrulous, it would be nice. So now if you take a symptom of thuja has a very very interesting symptom, congenital hernia. Now congenital hernia in a thuja case, sometimes you take a whole case, you take the history of your parents and history of the child, and you come to a remedy, and the remedy does not work. And then in that case, if it is hernia is congenital, think about the only remedies given is thuja. Okay, are you with me? Congenital hernia, again a very very important symptom of thuja. One symptom which somebody asked me in relation to nose and sneezing, I just remember one symptom of thuja. Coryza ameliorates most of the general symptom in thuja. So whenever the patient suffers from coryza, all the general symptoms are better. Are you with me? So these are the basically symptoms of thuja which you have to understand. A thuja, basically, if he's sitting and a patient comes and tells you that when I'm driving vehicle, I turn from left to right, my head, and it aggravates my complaint from left to right, not from right to left. So this is also thuja. Are you with me? Pain, or you can say turning from left to right, aggravates the complaints. And a thuja patient, when he's sitting on the AC, when he goes out, he feels much better, because warm weather, warm wind ameliorates the complaints. That's a very interesting generality symptoms of thuja. Of course, see, there are a lot of other symptoms of thuja and generalities all in mind, which you have to go home and read, because I cannot remember all the symptoms of thuja. And somebody had asked me to tell something about thuja in relation to vaccination. Can we use thuja as a prophylactic? So in Matermedica, in repertory, if you write prophylactic for vaccination, of course the remedies thuja is there, but variolinum is also there and sulfur is also there. So it depends upon your brains whether you have to prescribe thuja for vaccination or not. I told you yesterday also, if there is a lot of anxiety after vaccination and elements from vaccination, then you can think about thuja. Okay, are you with me? And nobody is answering right or wrong, only I am speaking. If you understand, at least write something so I know that people are understanding. Okay, otherwise it is like talking to the computer and no response. Hello everyone, are you with me? Thuja? Yes. No, it takes a lot of effort to first of all see that whether it is there in thuja, and then I have to tell you that it is there in thuja. So I remember some symptoms of thuja which I have used in my practice very frequently. That's why I am telling you the symptom. Now, one more symptom of thuja, for example, yesterday only one of my doctors who was working with me, she told that patient sleep cross-legged. Now, whenever the patient is sleeping cross-legged, which is the remedy? Anyone? The remedy is then rhododendron. In thuja, one symptom of yawning, because I am getting yawning today, so I am understanding one symptom of thuja. Thuja has, a symptom of yawning, and the yawning is better. And the yawning is better. So yawning is better by eructations. Yawning is better by eructation. The only remedy is thuja. Are you with me? Whenever the thuja patient has eructed, this is how I am telling you about a child. Not child, a person was giving the NEET exam. So he says, sir, whenever I start reading, loudly, remember the symptom. Whenever I am studying and reading loudly, I get yawning. And one of the remedy is thuja. I remember this symptom because I had given thuja to that child and the patient was better. Just one symptom of thuja that you must remember. A thuja patient, a pregnant lady who came to me, sir, my child, is fighting so much. See the wordings of the child, of the lady. My child fights so much. He does gymnastics, he does running, he does jogging in my womb. That wakes me from sleep. And the lady was pregnant. You can think, allopathic doctor think, okay, the child is very active and okay. This is a symptom of thuja. Two cases I will tell you. Waking movement of child in pregnancy is thuja. I had a case of ADHD, very hyperactive child, and asked the pregnancy history, and the lady told in pregnancy also that my child was very active, so much active. The Hindi word he used, बहुत तांडव करता था मेरे पेट पे, and I could not sleep because of that. So taking that history from the pregnancy and now the ADHD child, I prescribed the patient Thuja, and the patient is much better with Thuja. This is homeopathy, you know. If you understand what happens during the fetal movements and then how the child behaves, that also can relate to your prescription without taking any other symptom. I prescribed the patient Thuja and the patient is now much better. I hope you are with me. I hope you understood something about Thuja more. Next time we'll take some other remedies. But I would be happy if you ask me questions in YouTube live, because already I do remedy in Insta live, you know. So I hope that is taken care of, and it's already half an hour up. I hope you enjoyed as much as I enjoyed sharing my knowledge with you. For next Insta live on Thursday. Till then, bye.